Hi, today I want to talk about a few incidents that has left me surprised in a bad way. This has to do with our medical healthcare system. Although I have a lot of information about this segment, these incidents has got me worrying. Your medical cost rises by 14% year over year, which is probably the highest across all segments. Coming back to the story, recently we had to admit our aunt for one of the ailments, took her to the emergency room where we were told that we had to admit her to ICU and they recommended a surgery as well. They asked us to wait in the waiting room while they shifted her to the ICU. That wait lasted longer than we anticipated, close to 7 hours. It was very surprising because all they told us was they're just waiting for the room to shift her. We just had to hang in there and we couldn't do much about it. The waiting room itself was completely full. The people who were there in the waiting room, they're waiting for a bed, a room, or some kind of service. And these people waited as long as we did. When we finally got our turn to go to the admission section, the lady at the counter very nonchalantly said, "We were lucky to have an ICU bed because they were running full for the last 2 or 3 weeks." This is a very concerning trend. We already know that Indian medical health care systems are mimicking what's happening in the US. In the US, if you do not have insurance, medical costs can leave you in a severe debt. At least in the US, hospital cannot reject you whether you have insurance or not. In India, before even you admit the patient, you either have to furnish the insurance details or pay for the services upfront. This trend is not surprising. More people are now able to afford good health care. The middle class is going to explode in the next 10 to 15 years. However, the medical infrastructure, beds, is not keeping pace with the demand. When hospitals look at these trends, they can increase their services by 10, 15, 20%, and it would not have an impact on their fulfillment rates. All of this trend is seriously concerning. To address this, a lot of stakeholders have to come together. The medical infrastructure companies, the service providers, and the government, both state and central, have to come together to find a solution. While that happens, what can you and I do? In order to protect our wealth as well as health, we need to ensure that we have a private medical health insurance. This insurance should have good coverage and should not limit any of the services offered, such as room rent, limits on certain diseases that are covered. This will at least ensure that we have access to good healthcare and it doesn't cause any dent in our wealth or our future. If you'd like to know more about medical insurance, do reach out to us. We would be happy to do a free counseling session. If you're banking on a corporate health insurance, then you should look at this video, which talks about the deficiencies of corporate health insurance.